Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. So, if we determine that surgery is the best course of action for a patient, then the first step really is to explain why I think that surgery is the appropriate step for the patient at that time. That explanation will take into account your symptoms, your history, and then also obviously the imaging studies, and why I think that what I see on the MRI and the X-ray is the source of what you're feeling. Once that determination is made, then obviously the next step is to explain, well, what am I exactly going to do? Because the spine anatomy is very three-dimensional, it's not easy to understand. We obviously use models. I employ models in the explanation, so I will show you exactly where the incision will be made, how we approach the spine, and what I'm going to be doing exactly to whether it is the neck or the lower back. Additionally, I'll use animated videos that we employ to really show you what the process is going to be so that you can really understand it, because I think it is very important that every patient understand what is going to be done to them. Now, some patients don't want to see any of that, and that's also very understandable, but I do like for everybody to at least have some sense of what is going to be done so that they can feel comfortable with it. And obviously, if somebody doesn't feel comfortable with it, I want to know that too, so I can maybe explain it further and alleviate any issues or concerns that they may have. Once we're done with that conversation, obviously that'll take into account, discuss not only what I'm going to do, but also what are the risks, what are the potential benefits that we're seeking. And again, that's a lengthy conversation, but it's an important one to have. Once we've considered that, all the evidence, and we determine that yes, this is the best course of action to pursue, and everyone is in agreement, then we'll start the planning process for the procedure. All my procedures are done at either a hospital or a surgical center, depending on the procedure and where it would be the most appropriate location to do the procedure. Fortunately, every hospital that I perform surgery in and the surgical centers that I am a part of have excellent equipment in terms of the latest microscopes, fluoroscopic imaging, intraoperative guidance systems, as well as minimally invasive instrumentation. And this is important really because a surgery can be done very differently. Everyone can agree on what the problem is, but there can be different opinions about how to address that problem. So in general, my approach is to do what is needed, avoid doing what is not needed, and do that procedure in the most minimally invasive, minimally intrusive, and destructive way possible. And I say destructive because sometimes a procedure can address a specific problem, but in order to get to that problemed area, you have to go through tissues that are normal, and we don't want to disrupt those at all. But in the past, sometimes procedures were done in ways that didn't take that into account. The most modern techniques take the ancillary areas into account and make sure that we disrupt as minimal amount of those areas as possible in order to get to the herniated disc or the collapsed disc or the area of neurological impingement, correct that problem and not harm anything further along the way. The areas where we do surgery, we do have excellent anesthesiologists. They really are a part of the surgical team because we do have to run slightly different anesthesia than what would be done for a general surgery or other type of procedure. The reason is because during spine surgery, we do what's called neural monitoring. Neural monitoring is when, after you're asleep, we do employ neurologic monitors on the patient's body from the head to the arms to the legs, and this allows us to, in a sense, plug into the neurologic system of the patient. The nerves in the spinal cord are really like a closed circuit board of an electrical circuit. We plug into it so we can monitor the functions of those nerves throughout the surgery. This requires coordination between myself, the neural monitoring neurophysiologist, as well as the anesthesiologist. They have to run certain medications that will not interfere with that neural monitoring. The neural monitoring systems we employ are the most modern with the best algorithms, and they are active and present in the room during the surgery, and I rely on interactions with them to make sure that we are not causing any problems and that every procedure is undertaken in a safe manner. So we work with the same circulating teams as well as surgical technologists so they can be aware of any problems that happen in the room and really avoid any problems that could possibly happen during a surgery. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.